Hi there, my name is Tom Lewis. I'm here with Dr. Peter Lamb. We've been asked by JBJS to talk about our recent paper on fourth generation percutaneous transverse osteotomies for Hallux Valgus. Our prospective series of consecutive patients of 729 feet from 483 patients demonstrated a significant improvement to both clinical and radiographic findings. So I'd like to kick off with you, Dr. Lamb. What led you to do this research to begin with?
Well, I've been doing percutaneous or minimally invasive bunion correction surgery since 2011, initially starting with the chevron osteotomy and transitioning to using transverse osteotomy towards the end of 2017. And there's been a very few studies, pursuit of studies, looking at transverse osteotomy, and I just want to find out what the results of transverse osteotomies are.
So that's really interesting. So tell me, what findings surprised you based on this study?
The surprising thing was the overall low percentage of complications. In particular, we had a very low percentage of screw removal of 2.9%.
Mm-hmm. And why do you think that is? What kind of technique tips can you give listeners?
I think what we did was, when we looked at our long-term results with the chevron osteotomy, we found that as the bone remodeled, the distal screw becomes exposed. And so what we did was we changed our practice and we put the screw in a little bit further than the medial cortex to avoid this complication.
Yeah, I think that's really a really good tip, and really important to emphasize the getting good fluoroscopy findings to make sure that there's no signs of any prominent metalwork, because those patients are likely to come back and have a problem with pain and need subsequent operations. And I guess finally, to wrap up, what do you think is the most important unanswered question from this study?
I think the most important unanswered question is what the results like in the longer term. And so it will be nice to be able to do a longer term study like 10 years plus, looking at the results, seeing whether they're recurrence, whether corrections maintain, because there's no literature on that at all at the moment.
Well, great. Well, I look forward to seeing that and reading about that in the future.
Thank you, Tom.
Thank you.